Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. In part 2, we will now discuss the remaining W's: who, when, where, and why. Please see the introductory video of this channel for information about me, why I am making these videos, my declaration that I do not have any conflicts of interest or financial sponsors, and my medical legal disclaimer statement. Let's now talk about the second W. Who is palliative care for? Palliative care is for any person who is living with a life-threatening or life-limiting illness. This includes both cancerous and non-cancerous illnesses. And this applies to patients of any age, young and old. Now you may be thinking, that's a lot of people. And you would be correct. One of the biggest reasons the public often only associates the name palliative care with those at the end or within the final days of life is due to the lack of resources. Now, depending on where you live, there may be certain criteria that limits a patient's access to palliative care. Work is being done to change and improve this, but change takes time, unfortunately. Similarly, the public often also associates palliative care with patients with cancer. Although patients with cancer make up a large proportion of the people we look after, a palliative approach to care should also include patients with any life-threatening or incurable organ illnesses, and not just cancer. For example, patients with severe congestive heart failure, patients with kidney failure who may be requiring dialysis, or those who are already on dialysis and are not transplant candidates, patients with cirrhosis of the liver or other types of liver failure, patients with severe COPD, or other incurable lung diseases, such as pulmonary fibrosis, and neurological and muscular diseases, such as ALS. Now, these are just a few examples from a very long list. So to summarize this section, palliative care can be for any patient living with a life-threatening or life-limiting illness where the illness is unable to be cured. Let's now talk about the third W. When should one consider a shift towards a palliative approach to care? Patients and their families should consider such a shift when they are aware that their illness is not favorably responding to treatments, despite best efforts, or when the life-prolonging treatments are making the patient feel worse without any noticeable or significant benefit. At this point, people should be reevaluating what is truly important to them and how and with whom they wish to spend their more limited and precious energy. Typically at this stage, healthcare providers and doctors ask their patients, "What are your goals?" And in my experience, I feel people do not truly understand what this is asking of them. Instead, I like to ask my patients, knowing what you know about your body and your illness, what are your expectations of your body? What are your expectations of the healthcare system and of the people around you who are caring for you? Can these expectations be met? Is it achievable? And if they are not, then patients need to discuss with their healthcare team about what is reasonably achievable. Now, everybody's situation is unique, so open dialogue and discussion is key here. There is little harm in discussing these types of questions early on in the illness. Being prepared can make future decisions feel less daunting and less stressful. This is not dissimilar to planning for wills, estate planning, and establishing substitute decision makers in the event of an unplanned complication. So to summarize this section, patients and families should consider a shift towards a palliative care approach when their illness is life-threatening, potentially incurable, not favorably responding to treatments, or when the life-prolonging treatments are making patients feel worse. Let's now talk about the fourth W. Where is palliative care provided? Is palliative care even a place? This is such a confusing topic. Palliative care, as an approach to care, can be and should be provided anywhere patients are living. It can be in a patient's home, a relative's home, hospital ward, a long-term care facility. It is not limited to a specific place, and it doesn't need to be. That's the ideal scenario, of course. In real life, unfortunately, the resources and expertise available will be dependent on your location, so please speak to your healthcare provider for more specifics. But many people still associate palliative care with the words hospice care. These names are often used interchangeably, but they really should not be. It's such a confusing word, even among healthcare providers. The word hospice is often referring to a physical place, a building, or a separate area of the hospital or healthcare institution. And these places usually have patients who are near the end of their lives for any number of reasons, but more typically associated with patients with a terminal cancer. Depending on where you live, some of these places may be privately funded, while some are publicly or government funded. Similarly, some are licensed institutions, while some are not. Some may be independently operated, while some are associated with a local palliative care program, or historically, a religious organization. If you wish to learn more about such places specific to your location, please speak with your healthcare provider to see whether they are appropriate for your unique care needs. To summarize this section, palliative care, in general, does not need a designated location or happen in a specific place. Ideally, palliative care can be delivered anywhere the patient is. Let's now talk about the fifth W. Why should one consider palliative care, and why is palliative care important? Living with a life-threatening illness, or an illness that is not favorably responding to treatments, is hard. It's hard on the patient. It's also hard on their families. A palliative approach to care is important as it also looks beyond the illness. It looks at all the different parts that make up one's life as a big picture. As such, the focus of palliative care is to help ease some of the physical and non-physical burdens and stressors that patients and their families face. We aim to reduce the suffering of the patient and family where we can and where able. The palliative care team works together to improve a patient's quality of life. It is the team's priority to help patients live as well as their bodies will let them live, so that they can enjoy and feel as connected with their world as humanly possible. And that's why palliative care is important. Thank you very much for watching part 2 of this video series. I hope that you have found it to be useful in your journey. If you have any questions about your illness, or whether a palliative approach is right for your specific situation, please speak to your medical team. Thank you very much for watching this video series.